Afternoon and welcome. I'm Leanne Wells. I'm the Chief Executive of the Consumers Health Forum of Australia, and I will be your host for today's very exciting and important webinar in Budget Week. We're delighted to have you with us today as we launch the findings of the second Health Consumer Sentiment Survey. But firstly, I would like to begin by acknowledging, and we'll move to a slide that has some special words about that. I'd like to begin by acknowledging the traditional custodians on the various lands on which you all join today, and the Aboriginal and Torres Strait Islander people participating in this webinar. We pay our respects to elders past, present and emerging, and celebrate the diversity of Aboriginal peoples and their ongoing cultures and connections to the land and waters. I'm here on Ngunnawal country in the ACT in Canberra. So it's the beginning of Budget Week here in Canberra. Goes without saying that there's a flurry of activity happening just 10 minutes up the road from me at Parliament House. Our Federal Health Minister is going to feature in our webinar here today. And we've also got messages in response to the results we're going to be presenting today from Shadow Minister Butler as well. So it's great to be able to bring their perspectives and initial reactions to the very powerful data that you'll hear about in a moment from them. So later in the webinar, you'll get to hear from an expert panel, and I'll introduce those later as we look closely at some of the significant topic areas that were touched on in the research. But first, it gives me great pleasure to introduce our presenters for today. Founding Director of the Australian Institute of Health Innovation and lead for the National Health and Medical Research Partnership Centre for Health System Sustainability. That would have to take the award for the longest title of an organisation ever. Delighted to have Professor Jeffrey Braithwaite with us. He's joined by his colleague, Associate Professor Yvonne Zirinsky, and Yvonne is co-lead on the Observatory on Health System Sustainability at the NHMRC Partnership Centre. So Professor Braithwaite has had a distinguished career, and I know many in our audience today know him. A career as a lead academic in health services and system research. He's an award-winning researcher whose work is recognised internationally. And Yvonne is a highly experienced and mixed method health system researcher as well. Yvonne has a particular interest in patient and family experiences of the health system and is regularly engaged in collaborative research and policy development with consumer groups like ours, like CHF. So we've been delighted to be working across several fronts and on several projects with Yvonne and Jeffrey and their team. We've worked on the inaugural 2018 Consumer Sentiment Survey with them, and again for our latest survey, which ran in October last year. So a warm welcome, very warm welcome to both Jeffrey and Yvonne. Equal warm recognition and acknowledgement to their team. And over to you both to take us through some of the headline findings from the 2021 Australian Consumer Sentiment Survey.
Thank you very much, Leanne. And as always, it's a pleasure working with CHF and your team, really the leading voice for consumers in healthcare. So consumers, collaborators in the health system on the webinar, and colleagues. You know, there's lots and lots of voices inside the health system and outside the health system about the health system. There's like this cacophony, this multiplicity of stakeholders. But the voice we need to hear most of all is the consumer voice at all levels. This is an opportunity, was an opportunity for Australian health consumers to tell us what they thought of the health system. And it's a unique cross-sectional view of those consumers' voices. Because what we've learned, have we not? What we've learned is that the voice of the consumer is very important. Next slide, please. So what makes this unique? There's lots of information about healthcare. Everywhere you look, you can just go online. So this is a patiently and painstakingly designed survey that takes the pulse, if you like, it's a barometer on what people think about the health system. We've specifically sampled 5,100 people across the country, sampling the different groups that represent a voice in healthcare. But we've oversampled in groups that we don't hear enough from, so that the sample has that element of representation, but also explicitly seeking groups that don't often have a chance to speak. This survey, you have to bear in mind when we present some of these results in a few minutes, over the next few minutes, was conducted at the peak of the pandemic in October of last year. So you've got to bear in mind that's what people were experiencing as they gave voice in the survey. Thank you. Next slide. So the main question you might be asking immediately, if you haven't had a chance to read the report, and the report's now widely available, is the health system fit for purpose? There's a lot of views, but overall, the number of people who have a chronic condition hasn't changed much. 2018, when we last conducted this survey, to now. Thank you. Next slide. However, what did people tell us? Well, most people told us that they were satisfied with the services they received. 84%. I think if you get 84% on any test you do, that's a pretty good scorecard. Just below a high distinction, might I say, Leanne. I'm wearing my academic professorial hat here. Just below a high distinction. So that's not bad. However, when you drill into this, you find there are other things that Australians are telling us, that consumers are telling us. This is the highest rate of satisfaction compared to other surveys of its kind. Thank you. And remember, it's during a pandemic. So by October last year, we were accessing care differently. And you don't have to go very far in your own mind to know that. Many people were not seeing GPs face-to-face. They were telehealthing or telemedicine into their provider. And they said we also have difficulty accessing care after hours, more so than in 2018. But 71% said all these telehealth consultations that we're participating in are as good or better than face-to-face. So that was an interesting ring of approval for this shift to telehealth. I think we can conclude that consumers, perhaps because they had to, but consumers are embracing the digital revolution, and they adapted quickly, just like providers did. Thank you. Next slide. All is not well in aged care, and we didn't need perhaps an entire Royal Commission to tell us that, but the Royal Commission did tell us that in very great detail. And this is mirrored in our survey. So 23% of respondents reported that residential aged care services are bad or very bad. And we know that has to be improved. That was an increase from the 17% of respondents reporting that in 2018. So it's not better compared to 2018, in 2018 compared to now. Thank you. Affordability is one of the hallmarks of our universal health system. And I think it's clear from our report that that's at risk. 46% of respondents said they needed to see lower costs of care for their care and medicines. 14% of people with chronic conditions, and remember 59% of Australians have reported one or more chronic condition, couldn't pay for some aspect of their health or medicine. And 24% didn't fill a prescription or omitted a dose of medicine. And a third of the people in that 24% said this was because of cost. 58% of us have private health insurance, but those who didn't said they can't afford it or it's poor value for money. If you translate this into numbers, 1.5 million Australians at some level or to some extent struggle to pay for the full costs of healthcare. That's something that has to be on the agenda over time to fix. Thank you. And I'm handing over to Yvonne. I think I've actually overstayed my welcome. Yvonne, I'll segue into you.
Thank you, Jeffrey. I think the affordability question is a really important one because Australia does purport to have a health system that provides universal coverage. So universal coverage means that, you know, the system ensures equitable access to high quality care when it is needed without causing financial stress to individuals. And we're starting to see, and we have seen in other reports and in other surveys, that this may not necessarily be so. So as Jeffrey already highlighted, people are worried about the affordability of our healthcare system. And it's not so easy to access care for free anymore. If I think back to just last week when I saw my GP, I had to pay $75 up front before I could see that GP. In terms of having confidence in the ability to afford care when we need it, a lot of people said that they couldn't. They felt that they were not confident in affording care if they were to become seriously ill. And a significantly greater proportion of people who had chronic conditions, at least one chronic condition, were more worried about this. And as you can see, this was across both years, and the people with chronic conditions tended to have lower confidence in being able to afford care. And of course, these are the people who need it most and who are accessing care constantly. Next slide, Jen. Okay, so in terms of access and equity, 55% of respondents in regional and remote Australia said that they definitely needed more doctors, nurses, and healthcare workers. And we've been hearing about this for years. This is not a new finding, and yet this still keeps coming up as a message. I think the Grattan Institute talked about the two Australias, the rural Australia and metropolitan Australia. And it's most definitely difficult to access, particularly specialist care in rural regions. Disconcertingly and worryingly, 23% of people in 2021 reported being disrespected or discriminated against when accessing healthcare. And people who were identified as Aboriginal or Torres Strait Islander or both, or people who spoke a language other than English at home, were overrepresented among those, that 23%. Also, people who had had chronic conditions, so one or more chronic condition, were also overrepresented in that fraction. So clearly, we're not providing equitable care to all who need it. Next slide, please. The other thing that the survey did is to actually measure psychological distress, and this was led by Dr. Louise Ellis from the Australian Institute of Health Innovation, a good colleague of ours. We actually measured distress on the Kessler-6 scale, and 24% of respondents reported serious levels of psychological distress. And this was in October 2021. And these rates are higher than the pre-pandemic population prevalence rates by about 10%. And again, this aligns with other reports of increased psychological distress, as I'm sure Ian will talk about later. One good thing was that people felt they could access care through video conferencing and use telephone service lines, more so than people who did not have psychological distress. And those who use these services, 85% found these services useful and were satisfied with the service. So this is another positive finding for the use of telehealth modalities to access healthcare. Next slide, please. So these are just some headline findings from our survey. And as Jeffrey said, this is an important barometer of consumer opinions and experiences of the healthcare system, and really a crucial resource to inform healthcare policy and practice. We are doing a lot more detailed analysis of subgroups. We've got lots of information about socioeconomic measures for the people who answered. So income bracket employment, whether people lost their job over the COVID-19 pandemic, their education, access to social security payments, and including JobKeeper and JobSeeker. And we've got a really good mix of cultural and linguistic diversity in our sample. So we feel that a regular biannual survey should be undertaken to provide up-to-date data on consumer sentiment and experiences of the healthcare system to enable more accurate and informed policy development and service provision. Next slide. Okay, and I think Jeffrey again mentioned this before. It's been an absolute pleasure working with the team, especially with the Consumers Health Forum, Leanne and James Ansell and others. We co-designed the survey, which is really important. It's a consumer survey that actually has the consumer voice embedded within it. I'd like to thank my colleagues, Louise Ellis, Genevieve Damery, Kaylin Smith, Nicole Halim, James Gillespie from the University of Sydney, who provided some comparative data from the Menzies Nous surveys that were done over several years between 2008 and 2012. Catherine Vittignol and Liam Caffrey from the University of Queensland, who advised around the telehealth questions. And of course, Professor Jeffrey Braithwaite and Leanne Wells. Thank you so much. But most of all, I would really like to thank all the Australians who took the time to provide their answers to our quite a lengthy survey and to tell us about their opinions and experiences. Thank you.
Thanks very much, Jeffrey and Yvonne. And I think, as you can see there, this is a deep and rich data set. We're really presenting very much the headlines today. And even in that, there's a lot to chew over, which we will do with our panel, and I'll introduce them in a moment. We do plan to put the recording from this webinar online and share the slides with participants. So those who were asking about that, that's certainly the plan, and we'll send those out to you after today's event. So as I said, we do have messages responding to the data from Minister Hunt. We've got a pre-recorded message from him. He's got a very busy week here in Canberra, so couldn't be with us in person. He wanted to be, but passes on his apologies. And we've also got a pre-recorded message from Shadow Minister Butler as well. So we'll share those with you now. It's interesting to hear and insightful, I think, to hear their take on the data. And then that'll be a nice segue into what I hope will be a very interesting and robust discussion with our panel. So we'll queue up the videos now. Just bear with us. There might be a little bit of a time lag while these get queued up.
Well, welcome everybody to the launch of the Consumer Health Forum's Health Consumer Sentiment Survey for 2021. It's been 2 years, like no other we've experienced since the Spanish flu in relation to our health experiences. During the course of that time, 40,000 lives have been saved in Australia, but people have faced hardship and challenge, and in particular, our health workers have faced hardship and challenge. And I want to thank all of our health workers, our nurses and our doctors, our pathologists, our radiologists, our testers, our pharmacists, our policy workers, everybody involved in the delivery of health services. That's why this is such an important sentiment survey. Its value increases each time it's done because it's a longitudinal approach. It gives us a snapshot of Australian sentiment. That then brings me to the results. The single most important result, and one which is both heartening, but for some may be surprising, for others not surprising. But that is between 2018 and 2021, the level of satisfaction with the services received in the previous 12 months increased dramatically from 67 to 84%. What a testament to the work of our health workers. What a testament to the resilience of Australians, and what a testament to the way in which everybody involved in the design, the delivery and the execution of health policy in the states and the territories, at the community level and at the national level, have delivered for Australians, from 67 to 84% satisfaction. That is one of the extraordinary achievements of the pandemic. But the job's not done. That's absolutely clear. What we see is that in rural and remote areas, there's a need for better access. Now, telehealth is a fundamental enabler. 100 million services, widely welcomed as part of the sentiment survey. However, nothing replaces face-to-face services. And that's why in the budget, you'll see a 10-year rural health strategy, which is aimed at building by 3,000 the number of nurses, by 3,000 the number of doctors, but investing in the long-term health and training of people in rural Australia and giving them better access to doctors and nurses, pharmacists, pathologists, all of those in allied health who are supporting their health. At the same time, perhaps the most concerning figure is that approximately a quarter of Australians feel that they've been disrespected or in some way discriminated against with regards to their health services. That means, as a country, there's a task. I know that our doctors and our nurses, our health providers, those that run our hospitals, take the utmost care, but it's clear that that part of the experience has not been acceptable for a quarter of Australians. And so on that front, we must do better and will continue to strive, to seek, to find, but not to yield, to quote Tennyson's Ulysses. So I want to thank Leanne and the Consumer Health Forum, to everybody involved in the NH and MRC partnership. And I am delighted to officially launch the Australian Health Consumer Sentiment Survey for 2021.
Well, hello, I'm Mark Butler. I'm Labor's Shadow Minister for Health and Ageing, and it's a great pleasure to be invited to say a few remarks to the Consumer Health Forum on the occasion of your release of the latest Consumer Sentiment Survey. This is one of the most important pieces of research we have about one of the most important issues facing Australians in the third year of a global pandemic and leading into a federal election where certainly I hope that health will be an extraordinarily central part of our election debate. In many respects, the survey results come as no surprise because Australians have been telling me and my colleagues it's never been harder to access healthcare than it is today, particularly never been harder to get into a GP than it has been. And when you finally get in, it's never been more expensive. For the first time in the history of Medicare, the average gap fee to see a GP is actually higher than the Medicare rebate for a standard consult, very much driven by 6 years of freeze of the Medicare rebates under this government. We've also heard over recent weeks story after story of people deciding not to get a script filled or deciding among the many scripts they have to get filled which they'll defer because of the cost of prescription medicines being filled now for non-concessional payments. The survey also sets out the scale of the impact of this extraordinary, terrible pandemic that we've been living through for more than 2 years now. Hopefully, the worst is behind us in this pandemic, but there is still more for us to do. Although we rank very, very highly in terms of 2 doses of the COVID vaccine, Australians embraced it once it finally arrived on our shores, we rank very lowly in terms of booster take-up. 7th in the OECD on 2 doses, but 22nd on the booster uptake. We have to do better than that. And the survey also demonstrates, again, as we've seen in so many other pieces of research, the broader impact that COVID has had on our health. We know there's a backlog in screening. We know elective surgery wait lists have blown out, and we know that the acuity of conditions has increased as people have deferred going to the doctor or seeking other health care because of COVID restrictions. And terribly, because of our experience over recent years with natural disasters, we know, as your survey points out, there will be a very, very long tail of mental health impacts from this extraordinary, terrible pandemic. I really look forward, as Labor's spokesperson for health and ageing, to continuing to work with the CHF on innovative, groundbreaking ideas to deal with these health challenges. The CHF for many years has been an extraordinarily responsible, important part of our health debate, and so it should be. Patients should be at the centre of health policy. Nothing about us without us. Thank you for the chance to talk to you about the forum today and your survey. I really look forward to further engagement.
Come back to that after our panel discussion then. But those messages, video recorded messages from both of those political decision makers will be on our website along with the recording. So we'll move on now to the panel and I'll introduce some very eminent experts that we're delighted to have with us here today. Firstly, we've got Associate Professor Annette Schmid. Annette is the acting CEO of the Digital Health Cooperative Research Centre and also Chair of Research Australia. Welcome, Annette. We've got Professor Ian Hickey. It'll be a face well known to many. Ian is the Director of the Brain and Mind Research Institute and former National Mental Health Commissioner. Welcome, Ian. Professor Rosemary Calder has more than 2 decades of experience working in health policy and currently heads up the Mitchell Institute's Australian Health Policy Collaboration, and again, one of our very valued academic collaborators on several other projects. And we have Layla, delighted to have Layla Hallam with us as well. Layla's a consumer advocate. She's the chair of the Consumer Council, which is a subcommittee in New South Wales of the Clinical Excellence Commission in New South Wales. Layla has a passion for elevating consumer voice to improve safety and quality in healthcare services. Welcome, Layla. And Layla was also a member of CHF's Consumer Commission that we put together 2 or so years ago now. So I've got questions and discussion points that I'd like to put to all of you. And I'll start firstly with you, Layla, if I might. It was a surprising and very pleasing result, I guess, that satisfaction with health services had improved in this survey. And this is 5,000 people, so it's a significant number of people saying this compared to 2018. And notably, people said their confidence in the health system had also increased since the pandemic. What do you think is driving that view from consumers?
I think we have, by most clinical standards, we have one of the best health systems in the world. So I think we already begin on a pretty high benchmark. To see it go up over pandemic probably doesn't surprise me as much. I think we were a community, so an Australian community, watching what was going on overseas. The environment was very uncertain and the leadership came from our health departments. So being able to guide the community through what was a really uncertain time where people just didn't know, and being able to know that we could rely on the medical advice, which we were hearing all the time, and knowing that they were keeping us safe, which they were. And I think that that has put credits into the banks of the health systems right around Australia. And it was critically important. And I think that is actually, we needed leadership and we received it through our health systems. And I think that's what improved the confidence even more.
Thanks, Layla. And can I ask a follow-up question to that? Things aren't all rosy. There are highlights and lowlights in the results. From your perspective as a consumer advocate, where do the survey findings suggest to you that we need to do better?
So when we talk about confidence, it doesn't necessarily mean everything is perfect. It just means we need to trust the system because as patients, when you enter our health system, regardless at what level, there is some degree of vulnerability and our lives are in the hands of our system. So it's really important that our communities and our patients and our families can trust when they go in there, they're going to get the best possible care. Now, it doesn't always lead up to that expectation, but certainly it's critical that we have it. With regards to the gaps in what we saw in the feedback and the sentiment, I think access to care is a big one, and we've known about access to care all along. So the whole piece about availability, whether there's somebody actually available that can see me, the waiting time that it takes to actually receive or get into that care. And then, of course, there's the cost and the out-of-pocket, the upfront costs and the out-of-pocket. And I think that we're hearing that time and time and time again. And it was made worse by a health system, of course, that was distracted with COVID. So life didn't stop. You know, our heart attacks still happened. Our strokes were still happening. People were still being diagnosed with cancer. All the big things were still going on, but we had a health system that was doing its best to continue to provide business as usual care, but in a time that was very distracted with COVID. And I think that some of the gaps is that, you know, inevitably there will be some things that will have come out of the people who fell through those periods of time. So, you know, from a preventative perspective, from getting access to care quickly, all of those things, then what happens to those is the question then is about patient outcomes. So if their care was delayed, if their diagnosis was delayed, their treatment was delayed, then there is the next question about safety and quality and the impact on the patient outcomes. That's something that's complicated, but it is something that potentially is a gap with what happens next from where we've landed. The other thing that I'd say is probably two other pieces. One of them is about communication, and that really was about consistency in our communication. Now, we did pretty well. We had our chief medical officers in almost every state standing up every day and giving their press conferences, keeping people up to date. What we weren't doing quite so well was from a community perspective was being able to engage our communities in a way that worked for them, in a way they understood, in a way they could actually pick something up and actually do something with it. So I think communication, and again, it's age old, but I think it definitely showed that there were inconsistencies in our communication. I think we can improve that. I think we can work more closely with our communities, we can improve it. And the final one in my mind was by limiting visiting, so family presence. The big one, of course, was not having families available for patients as they were coming into our facilities. It's a really big one. They are part of the patient's care team, but being excluded from that, there will be repercussions from, you know, from transitions of care, from the from information sharing, from a whole host of things. The exclusion of families, I think, was a big one that wasn't quite so recognised by our health systems.
And presumably a contributor to some of those mental health impacts that we saw through this survey. So on that, can I turn to you, Ian? It's clear from this that levels of mental distress still plague us. Almost a quarter of people reported serious levels of psychological distress during the pandemic. We've been reading about that every day in the newspapers, and we've had some announcements in response to that. So the research found a particular prevalence, though, among the under 45s and young adults. So we clearly haven't got the system right here. What needs to change?
Leanne, so many things. So the big structural issues that are sitting underneath. So mental health, like aged care, like dental care, a lot of the issues that have never been resolved in the Australian healthcare system. And I might say the treatment of chronic conditions and access to specialist care in particular, which were really struggling pre-COVID. COVID comes along and there's a huge disruption in our lives. Interesting, in our lives, not just the threat of infection, but our economic and our social lives. So the mental health impacts have happened worldwide, independent of the rates of viral illness in those particular communities. So even though we were fortunate in Australia not to see some of the physical health disasters seen in Europe and North America, we have similar rates actually of psychological disturbance. That mainly affected women, young people, those in casual employment, those who are more marginal. It's always been the case that those with persistent and chronic mental health problems are poorer than other people. As a consequence, have had less access to effective care and less access to specialist care. I'd like to see more in your survey, as with the Grattan survey, of differentiating just access to care in general practice, one-off, or access to an emergency department in a crisis, from actually access to ongoing and effective care for chronic conditions, and certainly in the mental health area. because it's in those areas that affordability, that access and appropriateness of care are all really struggling. So we've had Productivity Commission reviews, we've had Victorian Royal Commissions. In my life, that adds to about 35, the number of significant national inquiries that we've had that all talk about regionalisation, that all talk about multidisciplinary teams, that now also include effective use of technologies. They all talk about the organisation of care, not simplistic step care models of going to a GP being sufficient or a one-off referral to a psychologist being sufficient. They also talk about the costs of that, which are very large. So we saw a huge surge in demand. Guess what? Supply actually went down. The telehealth research, people tended to see who they were already seeing and restrict further access. And the costs, guess what, went up. And the availability of care therefore went down. So suddenly you had very middle class, very middle families, lots of people going, and it was tough. I want to get care. I want to get my kids to care. I need to access care. Lots of government campaigns saying go to care, awareness raising. This is a big impact, which it was. Where, when, how much, how do I get it? You know, and actually in mental health outside of Victoria, we don't actually have waiting lists. We don't know. We just know that they're not available, books closed, can't see, you know, ring me next year, maybe. And we've had workforce and availability issues. So we've actually been caught out. Now we've been waiting government responses, you know, well, for 2 years now for the Productivity Commission report. There's said to be a new national agreement, but it's not actually consistent across the states and territories. And the fundamental structural governance issues of actually agreements between the states and territories and non-government organisations about the coordination of care in each of the regions where we live, unresolved. The appropriate use of technology. Telehealth is just the tip of the iceberg of digital healthcare. It's just substituting a phone or a video for an ordinary consultation is not much transformation. I mean, Greg Hunt did say we had more change in 10 days than we'd had in 10 years. That's true. That just shows you what we didn't do for the previous 10 years. And the challenge now in mental health is a lot more of the issues are more tractable with more effective use of technology, but it requires coordination, it requires financing, it requires really professional leadership and strong regional representation in these areas. So, you know, I think what your survey highlights, along with others by the Grattan Institute and others, is that you can have all the announceables you like, you can have all the press releases you like, you can have all the support for helplines you like, but unless you get to the structural reorganisation of care, particularly in non-hospital settings, you'll struggle. I was fascinated to see suddenly the rediscovery during COVID of hospital in the home. Maybe all these people don't need to go into hospital. Maybe if we ran the services from the hospital out. So we suddenly had a rediscovery of things that I remember when I was in the 1970s of actually quite specialised teams operating in people's homes effectively, now supported by technology, etc. Because guess what? We couldn't have all those people with COVID in hospital. It just made the problem worse. So it was really interesting. There are different things that happened, but we did see, unfortunately, surge in emergency departments. So we saw a 40–50% increase in emergency department presentations in young people. But the worst bit from my point of view was things like 40% representations to emergency departments. So people were coming to one part of the system, not being connected with any ongoing care. And guess what? Having to come back into emergency departments repeatedly. And for young people, on an average of 4 times through an emergency department. So seeking, as Layla said, I think people have confidence in the acute care bit. People know 24/7 where the light's on and where to go in an emergency, but that's just one bit, one critical bit of the Australian healthcare system that people have confidence in, but it can't function, particularly in mental health, unless it's linked with a much more appropriate supply chain of effective and affordable. So the out-of-pockets in our area, which were very high already, have now got much higher. So we have faced a crisis and surge in demand, but actually a crisis in inequity.
Thanks, Ian. And it's a big topic, isn't it? And you mentioned telehealth and that digital is much more than telehealth. So that's a really nice segue into, you know, you, Annette. You know, as Jeffrey said, it's pretty clear that from the results that we're embracing the digital revolution. I mean, probably in part that was driven by a degree of necessity in COVID. The pandemic fast-tracked the uptake of telehealth consultations, and the survey showed an increase of more than 30%. We're doing a lot of work with the Digital Health Agency, and I think it's probably reasonable to say that consumers and the community are embracing digital probably more than the provider clinical community, certainly in some craft groups in some areas. So encouragingly, we also saw, Annette, that around 70% said that telehealth was good or better than face-to-face care, which I thought was an interesting result. So a couple of parts to some discussion questions for you. Did that 70% result surprise you? And what could that mean for our health and the way consumers choose to access care in the future?
Thanks, Leanne, and delighted to be here today and just say that congratulations to everybody involved in the survey. It's a great asset, particularly this one. I mean, you've really built on previous years, and we're going to certainly use it at the Digital Health CRC to help us direct some of our work. Yes, it did surprise me, those figures, and I think that what it does is it opens up the willingness of the community and their confidence in using a range of digital technologies. You know, keeping in mind that, you know, telehealth is more than, you know, doing a telephone call with your doctor. And I do notice that there is a considerable proportion of telehealth represented in that survey. But what we've really got to also concentrate on is the whole gamut: virtual care, home monitoring, you know, a greater uptake of other digital technologies across the whole health sector. And what I want to kind of pick up on here, just as a bit of a backdrop, I mean, dropping telehealth or digital technologies into a complex and complicated healthcare sector in the way that we've just heard it described very eloquently by Ian. But once you overlay not just the structure of it, but you also overlay the funding of it, plus the federal and state involvement, you really have a challenge, because we may not get the value and the results that we are expecting until we fix up some of those underlying issues or address them. I mean, you know, I guess the structure and funding of Australia's health system is something I've been, you know, an observer of and a commentator on for some time. You know, and I think what a lot of people don't understand it, and I think that this complexity adds to people's frustrations, particularly those interfaces between the various elements. You know, I mean, the reality is 70% of funding of our health services comes from the government, and 70% is delivered by predominantly the private sector. And a lot of that private sector is a large number of individual and small businesses that are, you know, particularly in that the community and primary care space. So, you know, we've got various levels of capability, therefore, across the whole, and it's not, and we don't have a system either, we have various sectors. So that also complicates things. We have the primary care sector, community health sector, we have public hospitals and the private health sector, and we have aged care. If you put that all together, I mean, you really start to understand why any reform or change takes so much time, and why often we haven't got far when we've introduced, you know, pilots and you know, test examples of what we want to do. So moving back to the digital and the telehealth, yes, we've seen a rapid uptake, and yes, we've seen probably us leapfrogging a decade in areas that we were trying to get uptake, particularly from the clinician side and from the public hospital side. What we've had to do is rapidly, in some areas, transition into remote monitoring. I mean, when you look at all the telehotel services that have been provided, particularly in Sydney, out of Sydney Local Health District, thousands of people not just being monitored for COVID, but being monitored and looked after for mental health, chronic conditions, a whole range. We need to take that learning, and this is where the research comes in. We have to do the evaluations, because we're not very good in Australia at evaluating things and learning from them. But once again, COVID has tested us. Research is important and evidence is important when you're making decisions and you want to introduce new things and policy changes. So great platform that we've now got. Everybody's on board, hopefully, and we need to kind of use that as a foundation. My main concern is, I'd have to say, is getting the clinicians over the line with a lot of this new technology, not just the telehealth stuff, but things like artificial intelligence, decision support. And what we've found, and Ian, I know you've been talking about this as well, that we can have the best laid approaches, but if we get resistance at integrating those into existing models of care, we're just not going to get the benefits that we'd hoped for. So behaviour change is an important element of seeing the value that we get from all this, this digital uptake if we're really going to get long-lasting benefits to the whole health sector. Virtual care is a particular core area that we're looking at, and that has great value in terms of the whole equity and access issue. I mean, if we could be doing remote care from one suburb to the next, we've just been looking at a program at the Alfred in Melbourne. We can do that anywhere in Australia. But once again, we have to say, how's it going to be funded? Who's going to be delivering it? How does the clinical governance, quality and safety, what is all that we're going to start wrapping around all these new technologies and new models of care? So I think this is where we have great promise, and certainly with the digital health CRC, equity and sustainability is one of our areas that we've elevated. And always consumer, including consumers in that whole dialogue and discussion and co-design is very, very important. The only other thing I want to finish on, but we also have to be aware that digital healthcare could also create barriers. I think 25% of people in the survey identified that they had been digitally excluded. That's a lot, 1 in 4 Australians, right? So we have to identify what are we going to do about improving access and literacy in digital. The health digital has to be added to the whole literacy discussion. So often those people that are digitally marginalised are also socioeconomically marginalised. And I would imagine, Ian, that you'd see a great proportion of those people that have mental health issues make up that 25%. That would be an interesting thing to have a look at. So I think that, there's some proposals around what we can do there. We talk about digital navigators, but I think there's a real demand for how we're going to bridge that gap between those who are digitally literate, those who are not, and back into the healthcare sector. And I've got to say the digital navigators might need to be there for the clinical teams as well. That would be my last word on that.
And we're doing some work on digital navigators and scoping a model for that with in collaboration with the Good Things Foundation and the agency. I want to come back to digital health in a minute, particularly in the context of mental health, and we'll bring in Yvonne and Jeffrey into the conversation again in a moment too. But I just want to come to Rosemary first before we cycle back to digital and some comments about Medicare reform from the panel. The survey used a patient activation scale to gauge where people were at in terms of taking an active role in their healthcare. There's some questions in the Q&A box here about, well, what about prevention and what about self-management? So this really does pertain to that. Probably not surprisingly from the results, around 78% of those with higher activation, so-called higher activation, had a university education. They were more likely to have a higher income, and they were more likely to have private health insurance. But around 1 in 4 had low activation, and these are often the people living with chronic illness and young people in need of additional support. We talk about a 2-track system, we talk about 2 Australias, we talk about digital divide. I think this is at play here as well. So Rosemary, what specific supports thinking about the variation in patient activation and the fact that, everyone in health is saying we need to invest more in prevention, we need to keep people out of hospital. That means supporting people to self-manage their chronic conditions better, more effectively, and to stay well. What specific supports, and it's touched on digital navigators as an example of this, but what specific supports do you think could be provided and how should we make them available?
Sorry, I had myself on mute. I could talk for a long time about that, and I'll try not to. It is the deep challenge in our healthcare system. We fund through the door activity throughout the healthcare system. We do not fund reaching out to people who don't walk through the door. We don't fund healthcare for people who don't access it, can't afford it. We had a comment earlier that Yvonne made about universal coverage. When Medicare first came in the 70s, the thinking was in the 70s, it was to address the fact that we did not have affordable access to healthcare for over 21% of the then Australian population. It's extraordinary that despite the intentions of Medicare, we have maintained a financial divide. If you can't pay, you don't get. And we really have to be blunt about this. We don't have universal, equitable, affordable access. We don't in any way understand health policy. Well, we're starting to use the language prevention, but we don't understand our health policy as focused on keeping people in good health. We are still focused on treating illness when it walks through the door. So we have to change that perception. I think it's not at all surprising that people of low SES background, variously categorised by their education status, their employment status, their geographical location, have less access, have less activation on a patient activation scale, have less knowledge about health, have less understanding of how to self-care or self-manage health conditions and better health. It's a divide we know well right across all our associated systems. To me, the solutions are multiple. We've got to recognise that we need to fund for purpose, not for throughput. We need to take some of what we understand to be the thinking of the Primary Healthcare Reform Task Force and implement a multidisciplinary open door and outreach platform of primary care that is strongly focused on prevention right across the scale of prevention. And that's prevention of the risk factors for chronic conditions. It's then prevention of deterioration of chronic conditions. It's prevention of deterioration of acute conditions. And then it's prevention of unplanned admissions when a person is significantly unwell and dependent on ongoing care to prevent unplanned admissions. We don't do any of that. We wait for people to walk through the door. So we have to change the way we fund. 6-minute medicine is the biggest rate limiter of healthcare outcomes that we could possibly have. We've also got an 8 to 6 payment structure. We don't understand that health actually continues 24/7. It isn't in business hours only. We have to fund for access, not fund for throughput. We've got an artificial disconnect between general practice and specialist care based on controlling the dollars, not on maximising the efficiency of healthcare. We need to change that. And when we join the dots of the multiple systems we've got, if we aim to enable access for those who are currently blocked by financial or geographical or linguistic or cultural or digital barriers, then we might achieve a healthcare system. We've all referred to our healthcare system. We don't have one. We have multiple interconnecting, sometimes colliding systems. Overall, and we've said this in a paper from the Mitchell Institute some years ago, a bold government that actually wants to make healthcare effective and efficient and economically sound would work hard with colleague jurisdictions around the country to establish a National Health Services Commission and give that body of all governments with some independent governance the power to start creating a health system that is focused on universal, affordable, equitable access.
Thank you, Rosemary. Now, I want to come back to telehealth, and then I want to come back to you, Layla, because while it wasn't borne out in the survey gives us, you know, data from 5,000 people. But just a question to you, because it struck me, there was an OECD report that was published in December 2021, and it sort of crept out. I don't know whether anyone really noticed it, but it was really powerful, because what it found was that across OECD countries, with very, very few exceptions, patient voice is weakly embedded in the system. So we can do surveys like this, which are fantastic, and we need to see something like this funded very regularly. But in your work, speaking to families and carers and patients, what are some of the other best ways of capturing that consumer voice, particularly to get to ensure that we've got better design, better responsive services? Because I think we probably all agree, people on this panel today, that the patient voice and consumer insight probably fell a little bit beyond, you know, at the wayside through the course of the pandemic. So just some insights from you on that, Layla, and then we'll come back to telehealth.
Thanks, Leanne. I think COVID demonstrated one of the things that we've probably known for a while, those of us who work on the consumer side of the equation, that it's not deeply embedded in how we design things. The voice is coming into our multiple systems, Rosemary, but how they come in tends to be disjointed. They're happening all over the place. We do have some, and that's why there are some surveys. Some surveys are really important because they give us benchmarks, at least, that we can hang a hat on. So that it is really important. But one of the things that I have found is that talking to patients and families, we often hear that their expectations are too high, and that's not my experience of talking to patients and families. My experience of talking to patients and families is, firstly, sometimes they're quite reluctant to speak because there is I don't want to criticise, you know, I'm thankful for the care that they've given me, and therefore I really don't want to say anything negative. So when I explain to them that actually it's not about critiquing, it's actually about improvement, it comes out. And I hear all sorts of things. And I think if we can change the narrative, and I use the word really a bit because most people don't know what a narrative is, but if we can actually talk to people about the fact that we are seeking their feedback, not because we want to hear how badly we're doing or how beautifully we're doing, but actually we want to hear everything so that we can actually continue to improve. We want to be the best systems in the world. And I find that, so there's a multi-layered approach to that. So some of you will be aware of Don Berwick. Don Berwick has been doing work in this in the US with the IHI, and he was one of the authors of the Institute of Medicine. And one of the things that probably struck me most when I started this was he put out a call to the clinicians, and he said, every single clinician, every single nurse, everybody could do this. Just simply ask one question at the end of your interaction. Is there anything that I could have done better? Just give me one thing that I could have done better. And from a personal learning experience, every clinician might be able to take something away. They think, oh, that makes sense. Maybe I can do it better. But then from a systems, processes, facilities perspective, what we're trying to do is people like me try to listen in to that rich qualitative, what people actually want to tell us, and do it in a trusting way, but then also start to connect the dots, not just stories. Yes, stories are beautiful, but they don't connect. We want themes. We want to understand. And quite frankly, I think we know what they are. It's access to care. It's communication. It's all the things we know about. So to be honest, Leanne, I think the listening now is less the issue. I think now it's about embedding patients, families, and consumers into everything we do, from board level right through the organisations, right throughout the system, so that at every voice, the needs of the patient are embedded in everything we do. And what that will do is that will help us set up those processes. It will help set up the resources that we need in order to make those bedside interactions actually a partnership that we talk about all the time. So I think yes, it is about listening, and it is definitely about benchmarking, but it's also about action. It's also about, okay, we know what these are. Now we need to start to work together to find ways to actually begin tackling them, ask the hard questions and start working out, how do we do this as a community, not as clinicians, not as systems, not as patients, but together. How do we do this?
It's being systematic about it, isn't it? It's participation and involvement that's meaningful at every level, governance, service design. Yeah, indeed. Can I just come back to you, Ian, just shifting gears a little bit, back to telehealth and digital. Again, I think that was a pretty amazing result that we saw there presented by Jeffrey and Yvonne, that 85% of those with mental distress were satisfied with the care that they received via digital mental health. Now you could say, I guess, given the time that the survey was done, that in part that was again driven by necessity in the pandemic. But I just wonder, because I know there's quite a lot of leadership happening in the digital mental health space, I just wonder whether there are other factors at play there. Did you want to comment on what those factors might be?
Yes. And avoid the misinterpretation that it's simply due to the pandemic. It was true long before the pandemic. In fact, it's been expressed for a long period of time, particularly in mental health. It's not true in all areas of healthcare. And I'd pick up many of the questions that have been asked in the Q&A about access to digital infrastructure. I've got to say, for health for the future, to access and affordability of telecommunications infrastructure is health infrastructure. So next time you ask for a hospital, ask for a tower, ask for a phone, ask for an affordable plan, particularly live in rural and regional Australia. That'll be more important than a new emergency department you can't staff. You know, this is the health infrastructure of the future. And just to pick up Layla's point as well, it's actually how people get empowered every day rather than just through being consulted. If you're actually empowered through these systems. So I say this both in relation to answer your question, Leanne, because what we found in mental health over 2 decades is a way of people who are otherwise disempowered becoming empowered, getting the care they need, often on their own terms, not having to necessarily present at clinics they don't want to present to, picking up Rosemary's point, at times of day that don't suit them. We actually saw an increase of attendance at sessions, particularly our young people and others, through telehealth. It was their preferred way. Now, of course, clinicians, and I'm one of them, have been saying for decades, oh no, it's not as good. People don't like it. People don't want it. Actually, a whole lot of people who never got to the clinic get to the actual telehealth. They can get there. It's accessible. It's in their own time. It does run out of hours. It can run weekends. You know, you can deal with people actually, interestingly, in their own homes, in their own settings, and actually see more, see different. It's not the same, often see different to what you were seeing when they presented in other sets of settings. And actually interesting, of course, when it started and it was being bulk billed, it was really affordable too. It was on your terms and it didn't cost. Guess what? A lot of people in the mental health area thought, you know what? I like this. You know, and there's no 46-minute bit. There's no artificial time bit. There was, it's still a sort of time-based thing, but we've got to move away from that. So it challenged a lot of things. So a lot of the resistance, in fact, has been clinician-driven, not actually consumer-driven, as to whether this is optimal care. And it doesn't fix all situations, obviously. It's raised all sorts of new issues. Ones we've had trouble engaging the government over, about the regulatory environment, about privacy, about other issues, about affordability, how to actually finance it, etc. But from the user point of view, I'm not surprised. It was true pre-pandemic, and we shouldn't say it was a consequence of pandemic. What happened is people actually got to use it. Instead of being told you can't have it, they were told actually the only way you can have it is like this. And I think, like I should say, you know, I think it's like holding cars, right? When you only ever drove Australian cars, you thought they were the best in the world, until suddenly you got to drive one of those other cheaper Japanese where it actually decided, guess what? These other cars that were said to be no good, which were rubbish, they're actually quite good. You know, so I think there's this kind of interesting thing. We now have a lot of people who've had the experience of actually having different kinds of consultations, and that fits the research. And I think a lot of other things going on. Just to make my earlier comment, there are so many more bits. If you can put more information in and not waste time and follow up and have appointments move around and get access to more emergency care and changes in care, and the system becomes actually much more responsive to the changing needs of consumers, that's where digital health starts to become really interesting.
Indeed, it's our next big challenge, isn't it? Next big opportunity. Interoperability has got to be thrown in there as well, obviously. Well, look, I'm going to circle back now. We will try the Minister Hunt, Shadow Minister Butler videos again in a moment, but if our technology fails us, we will post them on websites. But I want to circle back now to Jeffrey and Yvonne, our lead researchers on this work. You've heard a lot about what the panel had to say. It's a deep conversation, this one, but I think one of the takeouts for me, and it just reminded me that Commonwealth Fund research, that, you know, when Australians get healthcare, they get good clinical outcomes. Our big pain points are access, affordability, health inequity, and it came through as a pretty common thread there to me that Medicare, as we know it, is not effectively delivering on its promise for universal, equitable access to care and affordable access to care. It's our universal public health insurance scheme, highly valued. It's got to underpin the system. General practice and primary care has got to underpin the system. From your perspective as health system research experts, what would be the 2 or 3 major reforms in primary care and in relation to Medicare, and the way we organise the system too, back to Ian's point, structurally, you know, the role of PHNs, for example, what would be the 2 or 3 big things for system shift and change from your perspective?
Let me have the first go, and I'm sure anything I say that's either wrong or needs mopped up, Yvonne will fix that for me. A couple of things. You know, I've been researching the Australian health system and other health systems for a long time. One is a concern, Leanne. We pride ourselves, and the WHO says we should have universal health coverage. We've actually, we're either treading water or going away from that. And that's not what Australians want. We want a universal health system that covers people when they need healthcare. And we're a wealthy enough country to provide that. The second thing is, I had a meeting with Tony Abbott when he was health minister almost a couple of decades ago. And he said something extremely interesting that I've never really forgotten. He said, when you're health minister, you realise that the Australian population thinks it's the best health system in the world and everything's stuffed simultaneously. Now, he was actually saying something that deserves more nuance than just that statement. And everybody who is Australian who hears that gets it immediately. We kind of do, don't we? It is sometimes the best system in the world, but we can't just ride on the coattails of that statement. There is stuff that badly needs fixing. Now, whether that's the improvement approach from Layla or the structural stuff that Ian made a plea for, or the digital enhancement that Annette has been a warrior for, including in her new job for decades, or the activation approach that Rosemary talked about, told me that we need all of those. Now, one of the things we don't have is a very clear-eyed approach on what should the health system look like, say by 2030, encapsulating all the things we've talked about. If we were to specify, and I can specify, you can specify, the whole audience can specify the health system we would like to have in 2030. I've done a whole lot of research on that. But you don't need to have done all my research. Everyone in the audience knows that. CHF knows that down to their bootstraps. We can specify that we want a cohesive, joined-up health system, that we want less volume-based care and more value-based care, that we want person-centered care, that we want access without financial hardship, and we want the workforce not for the present, trained for the present, but we want the workforce of the future that's digitally enabled and caring and all those sort of things. There's just 5 things. If we add those to the approach of Lila, Ian, Annette, and Rosemary, we've got a prescription for the health system for 2030. Why don't we specify that and then see if we can pull it off? Why don't we have this as a moonshot? I reckon we can do it.
That's inspirational, Jeffrey, as always. Thank you.
That's why you asked me,
That's right.
Leanne, you said, Jeffrey, you be inspirational towards the end. So
That's
I tried to pull that off.
Take us out on a high. Yvonne.
So I agree with everything everyone has said, and it's time for action, really. We've talked about this stuff for a very long time. We talk about fragmentation in our system, and we talk about the need for more integrated, interdisciplinary care, but our system does not support it. So I would like to see greater integration between primary care and secondary care and specialist care. I would like to see systems, digital health and ed, systems that talk across the sectors, so that we don't have people leaving ED and being left high and dry without a pathway of care, particularly people with mental health conditions. You know, they come to ED in crisis and then they're discharged to where? Often it's destination unknown. So having a pathway in and out of the hospital system is really important. I'm involved in a couple of innovative models of care where we're linking general practitioners with specialists. One is in cardiology, one is in pediatrics. But what stands in the way is the payment systems. So our Medicare system doesn't support very well joint consultations. And the same applies to transitions of care. So for instance, when young people transition from pediatric to adult care, and you need that, you know, interdisciplinary team from both pediatric and adult sectors, we don't support that. Access to specialist services, we really need to improve that and incentivize some kind of fair payment system. And maybe that means having bulk billed specialist services. So at the moment, you know, the specialists can charge any fee that they like, essentially. And there's huge variation in what they charge without any rhyme nor reason, nor linkage with the quality of care that's provided, apart from perhaps the location where they are. If you go to a specialist in Eastern Sydney, you pay more than a specialist in Western Sydney. Yep. So those things really need to change. I really hope that telehealth remains. I think it has been a huge enabler for people to access care, and not only people in regional and rural areas, it's for everyone, and particularly for people with mental health problems who may have low activation and may actually find it really difficult to leave the house to access care. So they're my sort of practical things that I would like to see.
Thanks, Yvonne. So a rallying call there, a blueprint for health 2030. Look, this has been a really terrific discussion. Can I thank each and every one of our panellists today for their generous time and their deep thought. And special thanks to Jeffrey and Yvonne and their highly skilled team. It's been a delight to work with all the staff at the AIHI and Macquarie University on this project. I'd also acknowledge the team working behind the scenes here too at CHF, putting together the launch, but also working with Yvonne and Jeffrey and team on the design of the survey. And finally, thanks to all of you who've registered and attended today. And we'll be posting the recording up on our website, so it certainly goes far and wider than just people who have registered today. The video links will be there, the links to the comments from the Minister and Shadow Minister, the links to the report. The report's already available on the Partnership Centre's website. The slides will be also circulated and made available. And I guess the last message we'd really like to leave with you, to the extent that we're all advocates for the same thing, is we really believe that a survey like this, it's deep. It really does, as Jeffrey and Yvonne said, it gives us a really powerful barometer to track how consumers are experiencing the system and where we can strengthen and improve healthcare in Australia. So we're really keen for whatever government we have the privilege of working with after the election to fund this as a recurrently conducted survey to really build that longitudinal data set. And goes without saying that we will continue to work with Yvonne and Jeffrey and their team on, you know, a series of several deep dive articles based on the data from the 2021 survey. So thank you again. Keep an eye out for those articles. We'll obviously be promoting them as they start to publish as a series right through the course of the next few years. We'll be promoting them through our channels. So thanks again for your attendance, everybody, and have a good day.